It's great to have Rob here. Um, Rob is the co-founder and now head of strategy at Forward, and formerly called Forward Health. And I came up with the title here, putting the health back in healthcare, because I know Rob's going to talk a little bit about that as being his approach. But Rob, why don't you just give us a sort of who you are, a little bit of background, and then we'll jump right in.
Yeah, I wanted to start by saying thank you, Drew, for having me, and thanks everyone for joining. I appreciate the time. So as Drew mentioned, my name is Rob. I'm one of the founders of Forward, and it's been sort of an eclectic path that's led me here. I've worked on a bunch of different things before this. Most recently, I was a product manager at Google. I worked with my co-founder here at Forward for Larry Page to start new Google companies. And then we left about 5 years ago now to start Forward, and I'm sure we'll have time to get into that. But that's what I have to say, spend a lot of my time on right now.
That's great. And talk to me a little bit about, we'll dive into Forward and your mission and what you're doing, and your ambition is grand, which I love. But I'm also curious, like, we talked earlier with Ogilvy and Novartis and Cheryl Shang about, looking at, give us your view of the healthcare system, right? And it was great to get their feedback. And, talk to me about how you view the sort of broader healthcare system, and then what prompted you to start Forward, what problems you're trying to solve.
Yeah, absolutely. I guess the first thing that I would say is I don't come from healthcare. I mentioned I was at Google before this. I've done a bunch of different things. So I actually, I have a bit of a different lens on the healthcare industry than maybe some of the folks that you spoke to. I'm very picky on what I want to work on. And the reason is because life is really short. So my personal mission, if we sort of abstract from healthcare for a second and just ask, why am I here? Like, I want to help maximize the qualities for humanity. So quality stands for quality adjusted life years. And I'm saying I literally want people who use the products that I help create to live longer. I want every year that they're alive to be higher quality. And I want to do that for the maximum number of people in the world that we can serve. So that's sort of my own personal mission. With that in mind, at Google, I worked on a bunch of different things. So I worked on food and agriculture, fresh water, climate change, gender equality, space exploration, transportation, cities, prisons, policing, employment, education. They're a weird set of problems that may not seem that related, but actually I'm only looking for three things when I'm choosing a problem. The first thing is this problem massive? Like, could you actually imagine serving the entire world if you get this right? The second factor is, if it's massive, is it meaningful? Right? Like, I don't want to spend my time working on a photo sharing app or on food delivery. Like, I want to work on the things that I think will define our time.
Yep.
And then the third factor is, if those two things are true, then I ask myself, could I imagine technology totally changing that system? And so that just gives you a sense, I guess, of how I choose problems. Obviously, now, if we segue into your question, which is, what are my views on healthcare? You kind of know what I think about healthcare, right?
Right.
It's massive, it's meaningful. Nobody ever debates me on those two things. But the third thing is the thing that I believe, that I think very few people have truly internalized, which is healthcare is going to be massively better in my lifetime. And the reason that I know that is because healthcare at the limit is an informatics problem, and today it's a labor industry. It's like, that's actually all you have to tell me. Like, this industry is going to be 10 times better sometime probably in our lifetime, because if it goes through that shift, you will build a massively better product.
Right.
And so that was sort of like that's my lens on problems that are worth working on, what I think of as worthy problems. Clearly, healthcare is one of the very few problems that meets that bar for me. And so I guess I'll give one last sort of thought on the state of healthcare today and where I think it could go, and then I'll pause and listen. But the question that has always really inspired me around Forward is, what if you had just invented a computer before a doctor? Like, what if you'd known that was coming? Because if you think about it, the humans that serve as doctors in our system today are incredible. Like, we have to choose the very smartest human beings, the most diligent, the most intelligent people to become doctors. But if you think about it, we're all actually incredibly flawed when it comes to the fundamental traits of what you'd want a doctor to be. Like, imagine for a second that you're the doctor, Drew. Like, you can't be with every human in the world at once. That's a problem. You can't see inside of my body. You can't see how I live my life when I'm not in your doctor's office, which is basically all of my life. You can't see what I'm thinking about or how I sleep at night or like any of these factors. And even if I gave you all that data on a silver platter, you don't have the compute to handle it, because it's a massive data science problem. And even if we solve all of those issues, you're expensive and you don't scale. So the whole point of Forward is to just ask, what if we had known that we were going to live in a world with iPhones and like genetic sequences for $100 and sensors in people's beds? Like, if we'd known all those things were coming, I'm pretty sure we wouldn't have built what we have today. Like we'd build something fundamentally different.
Right.
So let me just kind of listen and hear your thoughts. But
Yeah.
that's
No,
my
that's
sort of different lens on healthcare and why I'm so excited to work on this problem.
No, it's great. I like to get all the different perspectives. And before I get into forward, because I want to ask you what is forward, and I want to hear that.
Totally.
Let's start at the beginning. And I'm also very curious as we get into the conversation. Were there pivots? Did things change a little bit? If you were, say, talking with an investor 5 years ago, or just even the conversations with your co-founder when you were sort of thinking about like let's go start this. What problem were you trying to solve? What very specific problem were you trying to solve, or are you trying to solve? And has it remained the same since you started it?
Yeah, it's been exactly the same. And I think the reason is because if you're willing to be patient enough and think long term enough about the very nature of the problem that you're solving, that doesn't change that often. Like,
Mm-hmm.
so I think that's why like the conversation that I'm having with you right now could have been one we had 5 years ago. My sort of sense of where this is going and why it's important is exactly the same. You had asked what's the problem that we're trying to solve. So this is, we'll get into kind of what the product is today. And I think that's another probably better way to answer your question. But the business problem or the product problem that I'm trying to solve is known as the iron triangle in healthcare, right? It's actually the very same things we just talked about. What if we, like, what are your flaws as a human being? And what does that mean for the healthcare system? Well,
Right.
there's three things that people say are inextricably linked in healthcare today. Um, because we built a human or created a human doctor before a computer, the quality of healthcare is like far too low. And I'm not saying that someday I want you to book an appointment from your phone. Like that's a rounding error. I'm
Right.
saying that someday the quality, like you're going to have a God doctor with you at all times, constantly nudging you towards the best version of your life. Like, so quality is way too low because of the way we built this system. And we should aspire to something 10 times better. Then the next thing that you start to realize is the cost of healthcare is way too high because it's predicated upon these like brilliant humans who make $300,000 or $400,000 a year. There's some other structural issues with the system as well, but that's one of the biggest reasons is with humans as your main building block, you will always be expensive. Your marginal cost will never approach zero. And so that's the second massive sort of issue with healthcare. And then the third is I care about how well products scale because I care about my impact upon humanity. And a
Mm-hmm.
healthcare system built on the back of incredibly rare and talented human beings does not scale. And so the iron triangle is literally that. Quality, costs, and access cannot increase all at once. You must choose among them. And this is what results in dumb ideas like concierge medicine. Like
Right.
concierge medicine is saying, I think the iron triangle is true. So we're going to let some rich people pay a lot of money to get a slightly better product.
Right.
I'm like, don't even bother building that product. It's a net negative for society. I'm not saying game the iron triangle. I'm saying break it. Like you have to go in and actually rebuild the system correctly. Basically getting a massive improvement on a system the only way humans have ever gotten one since the Stone Age, which is to apply technology to some deeply technical problem and lever the whole system.
Right.
So you asked me what the problem is that we're trying to solve. That's the problem, is that I want to give the world the healthcare product that they deserve at scale. And the only way to do that is to be able to rebuild the system correctly.
And how are you trying to solve this problem? What is forward, and take us through your path from when you started and kind of where you are today, and then we'll talk a little bit about where you hope to be going.
Yeah, definitely. So Forward is building an entirely new healthcare system where technology is helping give insights that help you get ahead of your biggest health issues. And so we have doctor guided programs that take on the top preventable sort of diseases, things like cancer and heart health early so that you can live a longer, better life. So that's what we're building. The way it works for a member, just to give folks a sense of the experience, is we work entirely outside of insurance. So you would pay a membership fee to Forward. It's currently $149 a month. And the reason is I want to work for you, not for your insurance company. Like I want to be beholden to what is right for your health and for your sort of like well-being, not to what I get a billing code for. And so with that in mind, we use a bunch of technology-driven insights. So think things, data from your genetics or from your wearables or from our body scanner. And then you partner with our amazing sort of clinicians to work on the major important issues of your life over some longer period of time to try to get ahead of those issues. This could
Right.
happen in person in one of our doctor's offices. This could happen in your home right there on your mobile app or on your laptop. And the key is that we're focused on long-term results. So we're not focused on like your rash. We'll help you with that, but that's not the reason we're here. We're
Right.
here to try to prevent those health issues that like might prevent you from talking to your grandkids someday about your life. Like that's the stuff that I really want to focus on and emphasize.
That's great.
And so just to get a little bit more tactical, we've been
Please
around
do.
for about 5 years. We've got a dozen locations around the country. We're rapidly expanding and adding more locations this year. And we started, as you probably know, with primary care, but we've already started to branch into a bunch of the specialties. I mentioned actually cancer and heart health. We work on mental health and genetics. There's a bunch more we're adding this year. So that's kind of where we are today. Let me pause. I know you also asked sort of the journey that got us there, but I want to see if this is helpful before we move on.
No, it isn't. But I do have a question based on what you were just saying. And I know we talked a little bit about it in our prep call. Why isn't the system? It sounds so common sense oriented, right? Why can't the system focus on health care and not sick care? And I know that that is sort of a core sort of opening that you see, and I think, and it's so common sense oriented. And what, without going deep into sort of the structures of the iron triangle, if you will, but why doesn't the system focus on this? It just makes sense. It's you're focusing on that I never get to the hospital and have to worry about a $20,000 bill or a $50,000 bill for this or whatever, right? So why isn't the system built around healthcare?
Yeah, I would say two things. One, I want to expand on your point for a second, and then I want
Mm-hmm.
to give you what I think is the answer to your question. The
Please.
thing that you're sort of hitting on, the way I often describe this is healthcare is arbitrarily narrowly defined. Like healthcare today is defined as what happens in the sort of like 12 minutes a year you spend in a doctor's office inside of those four walls, telling some half truths about how you've lived your life over the last year.
Right. Right.
And like that's the definition of healthcare today. And as you suggested, it's by definition reactive, not proactive. It's very sort of tactical, and it's not particularly helpful for your long-term health. Uh, the key is to say, okay, what if you weren't trying to define healthcare, and you said and instead just asked, what is health? Health is like not what happens in that room. It's what happens every other instant of your life. It's what you eat. It's
Right.
how you sleep. It's how you exercise. So I really agree with your point that actually like this is too narrowly defined as it is today. So how did we end up here, which was your question? I
Yeah.
think that there's probably two main issues that I see. The first is the incentive structure of healthcare is broken, right? The incentive structure of healthcare is based on something known as fee-for-service insurance. And what that suggests is a doctor is not paid for satisfaction or quality or long-term outcomes. They're paid for actions that come from a billing code that came from an insurance company. And as soon as you think about it that way, you're like, wow, that is not really about how to help you live a longer, better life. That's about what is the billable event happening right now that I can
Right.
get paid for.
It's like a law
And
firm
so I
almost, right?
think, yeah,
Billable
exactly.
events,
I
right?
think that one huge issue is that we don't know how to reward proactive preventative care. We only know how to reward heroic interventions, right? So that's the reason that we pay somebody $100,000 for heart surgery and we pay $0 for all of the subtle nudges in behavioral health that should have happened for the 40 years before that heart attack.
Mm.
So that's one major issue, is I think that the incentive structure of the system is incorrect. But the second major issue is that that is alone necessary but not sufficient. What I mean is, people, when they talk about healthcare today, love debating healthcare as though it's a business problem or it's a policy problem. And so this is the sort of like conversation about, should we have a single payer system or a multi-payer system? Should we have private insurers or should it be a public offering? Like, I think there's a better answer than what we have, but I'd also say that that is shuffling deck chairs on the Titanic.
Right.
Like
Yeah,
the reason the
completely.
Titanic is sinking is not a policy problem. It's not a business problem. It's a product problem. We're trying to provide a service that is an informatics problem at the limit using human beings as the building block. And as long as that's true, the iron triangle will be true and the boat's going down. And
Mm.
so my answer to your question is I think there's some structural incentive issues, and then there's a lack of product vision and sort of definition of what this could be, what this could become, that keeps us focused on the myopic optimizations of today and not the vision of a world that could be massively better than it is today in terms of the product that we provide.
And I'm curious, and then I'm also just going to throw it out into my production universe here. What you guys are doing, I think, is probably something that's very of interest to David Kirkpatrick, who's the editor in chief of Techonomy. So, David, if you're listening, I'll just say, can you message me, which I'll see, if you'd like to ask Rob a question, and if David would like to ask you a question, I'll bring him in a minute. So sorry for the internal workings there, but what I'm curious is, fundamentally, I don't think necessarily, and this could be wrong, and correct me if I'm wrong, the pandemic hasn't necessarily changed sort of the fundamental problems that existed with healthcare when you started the company and the opportunities that are there for you moving forward. But I am curious if you've learned, if the pandemic and how people are, dealing with this type of an issue has changed their mindset. Now we see telehealth. Is there anything that's happened in the pandemic that has fundamentally sort of changed your perception of patients broadly, what they expect? And has it changed sort of your approach to your business at all in any kind of a way? Or is it still, the problem was the same before the pandemic, it's still the same after the pandemic, and our opportunity is the same? Or has the pandemic changed any of your calculus regarding any of that?
Yeah, I think I guess the first thing that I would say is like, I think even something as big as a global pandemic recession shouldn't change your vision. Like if it does, then your vision probably wasn't long-term enough. It wasn't durable enough, right? So
Right.
it hasn't changed the vision of what we're trying to do here. That said, it has massively accelerated the roadmap. And I suspect this is a recurring theme for a lot of technology companies. It's given us permission to do more wherever someone lives their life. And so what I mean is like, for example, the entire first visit of Forward is something known as a baseline. You come into a beautiful doctor's office. Many people comment on the architecture and how nice it is. You stand on a body scanner. You sit in an exam room with a huge smart screen on the wall. This was a hero experience for Forward. And as you can imagine, in March of last year, we said, wow, we can't bring people in to do that right now. TBD how long it's going to be that before we can. So we said, let's take that entire experience and ship it to your home.
Mm.
And so over the course of 4 weeks, we took the entire Forward baseline and we launched it in Forward at Home. So what we did was we said, instead of a body scanner, we're going to mail you a box of sensors. So it's a beautiful Forward package with a bunch of key sensors to capture the data we might have gotten on the body scanner. Then all that data plumbs through to the smart screen. So we took the entire huge like smart screen on your wall and we shipped it onto your laptop. And I'm not saying a Zoom call with your doctor, that's not enough. One of the key things we learned over 5 years is we need a shared working surface for you and the doctor to work through your data together. So you
Right.
see your lipid levels and your cholesterol right there on the screen. You see all the data from the sensors that we've given you, and you talk through these issues with your doctor live. And so that's a really cool example of where obviously I think art is constraints in many ways. We were
Mm-hmm.
forced to take a very hard constraint. What if you couldn't give like the hero starting visit of Forward in person and you had to do it in their home? And so we shipped that. Obviously, it was a necessary sort of step to take during COVID. But what's amazing is users love the experience. And so we're now able to leap 3 and 5 years down the product roadmap because I've been essentially given permission by users, having built this product and seeing how they react to it, to do more and more care in your home, which again was always where we were going with this. But this has like helped us really jump down that roadmap. And so I think that obviously this was an incredibly hard year for humanity overall. And I won't say that there's a silver lining to this, but we managed to turn defense into offense. We managed to turn the idea that we had to figure out a way to get our first visit to work in your home. And now there's like a whole bunch of creativity that's unlocked on the product roadmap for us.
No, that's great. And before I go to David, David does have a question, so we can turn David's video and audio on here. Rob, in like sort of 30 seconds or less, I'm wondering, for all the product innovators out there, you've done it at Google, now you're doing it now. Do you have, some nice snippy advice in regards to product innovation and the process there? Like when to, cut your losses and that's not working, when to invest in it and say, we're going to really go for it. But what's your very sort of brief, condensed advice as it relates to driving product innovation?
Yeah, I have, I guess, a couple of quick thoughts. One is, I think you need to have a really strong sort of like intuition for and vision for where this all ends up. One of the questions I often ask is, at the limit, what will this look like? And just that simple forcing function forces you to get out of the conversations of today and just envision what it should have been if you'd built it right. So that's extremely helpful, which is to have a strong opinion about the vision of where this thing goes long term. Then tactically, more day to day, tie your product innovation to the metrics that drive your business. I took a very opinionated business model because I don't want to be beholden to the broken incentive structure that I mentioned earlier. That said, when we are saying we have a cool new feature in mind, we ask ourselves, what metric is this going to move? Is this going to move growth or retention or our economics? Because we need those 3 things to work to continue to sort of scale and give this to more and more people in the world. And so I think being disciplined around asking, what problem am I solving, is crucial. So have a strong vision of where it's going to go long term, and then ground that to the day-to-day realities of like what you're trying to accomplish with any individual feature.
Yeah, that's great.
That's helpful.
David, I'm gonna let you ask the last
Thank
question
you.
of Rob. I know you have a good question.
Doesn't have to be the last one, but if you're going to challenge me, I'm going to come up with a question. And I have to say, Rob, your energy and Forward, really impressive. I'm going to ask about something that I'm pretty sure you have a strong opinion about. It's a little bit different from the topic you've been discussing.
Sure.
But Amazon, JP Morgan, Berkshire Hathaway had this Haven thing. right?
Yeah.
You know, is another really ambitious, we thought, effort to intervene in American healthcare, which seems to have, based on external view, kind of foundered. What do you think of that? Was it a good effort? Is it likely still to come to some fruition? And you know, if something serious went wrong, what do you think it was?
Yeah, I don't want to opine on like the inner workings of what happened at Haven and what may or may not have worked there. Um, I guess what I would say is it's fundamentally hard to do what we're trying to do. So the message that I sent to the team actually along these lines was not about like, you know, oh, I think this worked and this didn't, but rather those are three like incredible companies that bounced off of this problem. What we are trying to do is incredibly hard. And I say that to the team because they feel the day-to-day pain of some of the principal choices that we made, right? We said we were going to go full stack, which is to say we hire doctors, we build doctors' offices, we build hardware, we build software. That is a massive risk. And our amazing team here feels the challenges of that every day because they have to execute across all of those areas at once. So that's one way in which we're doing is incredibly hard. And then the other is this business model. Of course, it'd be easier for me to take, you know, insurance and have that be the business model of what we're working on today. But I chose to take a cleaner incentive structure because that's the only way to get to where we're trying to go long term. And so rather than opining on what I think worked and what didn't from what Haven worked on, all I would say is this is an incredibly hard problem. And I use that to try to give context to our teams and to keep them sort of motivated and inspired as we work on this problem. We've taken a very hard problem. We made it even harder up front in exchange for the possibility that this could be massively better down the line. So David, sorry that I don't have sort of like
Well, that's all right.
on what happened
If
internally,
it's
but
such
I
a
think
hard
that's a good
problem,
indication.
real quick. So, I mean, you're doing something very impressive, but still at pretty small scale, given the size of our country, et cetera. Do you think there's a likelihood that we're going to see, and maybe the current administration could help, some significant, massive transformation of the American healthcare system in the near term that we will all really feel?
Yes. I doubt it's going to happen based on any one administration because, as I mentioned earlier, I think this is less of a policy problem and more of a product problem. So I do think that there's different policies you could put in place that would be helpful, but that's not where I spend my time. And it's honestly not what I think the 10X is on this system. I think you can get 10% out of business model and policy. You can get 10X out of product. So the thing that I would mention in terms of, you'd asked, do you think it's possible this will look massively better in our lifetime? I believe it was Bill Gates that mentioned famously that we constantly overestimate what we can do in a year and underestimate what we can do in a decade. I think the same thing is going to prove true here. Like any given day, it feels like a slog, like we're working on incredibly hard things and maybe that isn't working exactly the way that you'd want in that moment. But if I look back even on the 5 years of forward, it is insane like how much progress we've made on this problem. I'm sure if we look forward another 10 years, the world is going to look massively different. So you're right that we are small relative to this country and to the entire sort of global society that we intend to serve over time. But technology has a way of stacking gains, right? Like we're not playing for linear improvement on the system. To do that, I would have worked within the existing system with the same broken incentive structure and with the same product. I'm playing for compounding gains, and those look wildly different over the course of a decade.
Very cool. Love the
Yeah.
ambition. I'll turn it back to Drew. That's
Me
great.
too. Yeah. And thanks for being generous with your time here, Rob. My one getaway question, though, is that last one we talked about, and I'll bring Josh in to help us close out as well. But,
Sure.
you know, I asked you how you stay informed, and you answered a little bit differently in terms of your breadth and just getting into the, someone like you and your mind, because it's very impressive, and your ambition. So, you know, how do you stay maybe not informed necessarily about all things healthcare and all that, but, you know, how are you growing as a professional and staying sort of informed in a broader sense?
Yeah, I mean, I think in terms of how I grow as a leader, like so much of that is driven by my teammates, right? We have an incredible team of leaders from companies like, you know, Google and Uber and Tesla and Airbnb, who've dedicated their life to trying to use technology to build like meaningful, helpful things in the world. So a ton of it is just by osmosis, by working with such amazing leaders on our team and learning from our teammates. And then in terms of like what I read and how I try to stimulate my own mind, as you suggested, it's not so much on the day-to-day of the industry that I'm working on. I actually listen to lots of like historical biographies. So I grew up loving art and math and science. And those are the sorts of people that I love reading about and learning about. And that helps me keep my breadth on a problem. And similarly, like what we were doing at Google was not focused on one thing. It was focused on a really broad set of problems. And you find some amazing patterns across these things if you continue to stretch your mind across many domains. So anyway, I hope that's helpful, but that's what I
Yes.
spend a ton of my time on, is just listening to and learning about others that really inspire me.
No, it really is. Well, thanks again for staying extra time here,
Of course.
and congrats again. It's impressive what you're doing. I appreciate you come sharing your story with us, and I look forward to continuing the conversation at a later date, hopefully in person.
Yeah, thank you so much for having me. Looking forward to having a bunch more forwards around the country soon.
That's right. Thanks, Rob.
Thank you. See ya.